Hello, my name is Caleb Smith with the Rocket Miner newspaper, here to provide your COVID-19 update for April 22nd, 2020. Across the world, across the country, across our state, and even down to Sweetwater County, on public forums, on Facebook, and even in our own Rocket Miner newsroom, there's a lot of debate about what numbers are available, which ones are being used, what do they mean. So let's start with those tonight. I'm using figures provided by the Sweetwater County Emergency Operations Center. They're a little bit older than I'd prefer. These are as of 3 p.m., but I appreciated how they organized the figures, so that's why I'm going with them this evening. When it comes to global confirmed cases, they put that number at 2,614,040 people. When it comes to the worldwide death total, that's at 182,004 people who have died. When it comes to recovered cases, that number is put at 706,636. So that's great to see. In the United States, it puts confirmed cases at 843,186. When it comes to the American death toll, that number is 47,139 people. And when it comes to recovered, that's 76,864 people. In Wyoming, the state is delineating confirmed cases versus probable cases. Cases where people have symptoms and had contact with confirmed cases, but they haven't gotten testing. We'll talk a little bit more about that momentarily. But they're breaking it down with 326 lab confirmed cases and 121 probable cases. So that's about 447. When it comes to deaths, that's currently at 6, with the addition of 4 people who died on Monday. When it comes to recovered cases, there are 200 people from the lab confirmed case who have recovered. That leaves 126 active confirmed cases. When it comes to the probable cases, out of 121, 75 people have recovered from that group, leaving 46 probable active cases. In Sweetwater County, we have 10 confirmed cases and 6 probable, and of that number, if you combine that numbers into 16, 9 have recovered total, or that's 6 of the lab confirmed cases have recovered, along with 3 of the probable cases. Also, when it comes to recovered, let me share their definition for that. According to Sweetwater County health officials, a patient is considered fully recovered when there is a resolution of fever without the use of fever-reducing medications. Has your temperature gone down without you popping anything for a while? In addition, there must be an improvement in respiratory symptoms for 72 hours. Have you stopped coughing? Are you no longer short of breath, or have that pain in there? And at least 7 days have passed since symptoms first appeared. You want to give it enough days to make sure that you're no longer actively coughing, hacking, whatnot. That's current guidelines as outlined by the Wyoming Department of Health. Now, those are all good figures to have, and they're the best ones that we have available. The issue is that a number of health officials are saying that they may not be telling the full picture. Sweetwater County public health officials caution that the low reported numbers are deceiving, even with the addition of probable cases. Sweetwater County health officer, Dr. Stachon, said that any apparent decrease in the rate of new infections more likely represents a lack of widespread testing than an accurate reflection of the spread of the disease in our community. The gist is that without easier access to testing, we can't be super confident about what the actual spread is. Right now, there really shouldn't be any probable cases. It's a shame that because testing is limited, many places are choosing to, for the cases that are probable, that are less severe, it's that people are taking the choice to isolate themselves, quarantine at home without being required to, just because they want to limit testing supplies. In an ideal world, testing would be much more widespread. In general, we know that Wyoming is behind the trends. We are one of the last places to get a positive case. We were the last state to get start the fatality count. And while we're thankful it's low, because of the timing involved, we would anticipate that even when other states are getting back to normal, have fully lifted their restrictions, it's not too hard to to imagine that Wyoming will be one of those places that will be last to reopen. We're used to that. We've gone through it before, many a time with boom and bust. When other people are recovering, we're still in hard times. We know how to knuckle down and still persevere. We also recognize that what's good to maybe just to the east or to the west isn't necessarily what's best for us. Hopefully, testing will become more widespread, and as we do that, hopefully the numbers will go down. Those will be some of the indicators that it's time to be able to reopen more stuff. We are still anticipating more word from the governor about what those guidelines will be. That will be something that was brought up at the Rock Springs City Council meeting last night. That's the hopes that more information, more guideposts, and goals that we can be keeping an eye on so that when we reach them, we'll know that we're getting close to the end of the tunnel. One other bit of deja vu that occurred at the City Council meeting was due to the social distancing being practiced by members of the council. The mayor's been attending every meeting, but of the 8 council members, they've been taking turns with 4 council members attending every other meeting. That way they're not going past the gatherings of more than 10 people. I sat outside council chambers while other people actually left that part of City Hall to make sure that they didn't have more than 10 people in a room. As part of that, that means that with the 4 council members plus the mayor, that's a quorum of 5, so that means they can take action. But there was questions raised last night about whether they could still pass resolutions with a member of the group abstaining from a vote. There were 2 resolutions that initially passed in a 4-0 vote, with alternatively Mayor Tim Como and Councilman Rob Zotti abstaining from the vote. Right after the second one had occurred, there were questions raised about whether or not having a majority of the people in attendance, 4 out of the 5, for a majority, was enough to pass a resolution, or whether or not they need to have a majority of the council, 5 out of 9, even if four people weren't there. While there was some review of the law going on, the council made a decision to table those 2 resolutions, even though word came back soon that they were able to pass such resolutions in these cases by a majority of those there. That put the council in the position to, having already passed certain resolutions, they had to untable the motions, vote on them again by the same margins, and still go there. Well, that prompted the mayor to make a reference to the movie Groundhog's Day, and there was more than a little bit of joking around that. I would like to praise the council for taking these extra steps. One of the things said during the meeting was that we want to get this right. And even when things are a little bit nuttier than usual, and they're not the norm by any stretch of the imagination, I appreciate those who are taking the extra steps to make sure that they are abiding by the law and being accountable to the people and these laws that we've agreed upon ourselves to govern us. And other good news, the Memorial Hospital, Sweetwater County's Hospital Foundation, secured grant money to buy chest compression devices. It comes from money provided by the Leona M. and Harry B. Helmsley Charitable Trust. The Memorial Hospital Foundation secured a grant totaling $50,541 to purchase 4 Lucas mechanical chest compression devices, or these are mechanical CPR devices. The idea is that it will be needed both potentially for coronavirus COVID-19 patients and to keep those who treat them safe. Research has shown the cardiac damage in as many as 1 in 5 COVID-19 patients, leading to heart failure and death, even amongst those who show no signs of respiratory distress, according to the press release we received from the hospital. The goal is that the machines will be able to take over the job. If you've ever had first aid training, you know the BG staying alive, the steady rate of compressions that you have to be keeping to keep the heart pumping, so you have oxygen and everything, and all the other everything else running. You may have known that if you practice on a partner, hopefully lightly, or if you're on a training dummy, that compressing the chest usually forces air out. Even when you're having a face mask and whatnot, that's still a risk to those who are performing this stuff, whether it's the emergency medical technicians, firefighters, police, other experts on scene, or those in the hospital. The idea is that this will be able to keep them providing high-performance CPR, as well as limit their exposure in that case. So that's good for those who need medical treatment. It's good for the people who provide it. It's also noted that it's the hospital stuff now. They don't have to give them away when it's done. Hopefully when COVID-19 has settled down and in the near future, we will still have these machines in place to continue to be a resource that can be just part of the hospital's cardiac system of care. Like I said, whether it's doing what you can to keep a person's heartbeat going or doing what you can to preserve the heartbeat of the community, we're all looking for ways to keep that rhythm going. This has been Caleb Smith with the Rocket Miner newspaper, wishing you a good day and a safe tomorrow.